why does it happen in the first place? Well, for as much as we don't know about this disease, we're pretty certain that a lot of it has to do with the abnormal development of the blood vessels of the placenta early on in the course of the pregnancy. So the blood vessels in the placenta just don't develop correctly. Now, if you remember, during the formation of the placenta, the trophoblast cells of the embryo, which this is the embryo, right? And these green cells on the outside are the trophoblasts. The trophoblasts invade through the decidua, which is what the endometrium is called during pregnancy. And they also invade through part of the myometrium. And they do this, the trophoblasts invade through the decidua so that they can access and infiltrate the spiral arteries, which are the terminal branches of the uterine artery. So they're the arteries that supply the uterus. So they infiltrate the spiral arteries to get access to all of that oxygenated blood that's inside them. And that's how the placenta forms into this bed where blood exchange between mom and fetus can occur. It's because of this first step of the trophoblast invading into the spiral arteries. Now, in order for this to happen successfully, I guess you could say two things really have to take place. Two things have to happen. Firstly, the trophoblasts have to be pretty aggressive in their infiltration. They really have to dig into the decidua. And secondly, the spiral arteries have to remodel themselves. They have to go from being these narrow, thick-walled blood vessels to sort of being these large, kind of tortuous vascular channels that allow a large amount of blood to flow through them. So both things have to happen. And we think that preeclampsia occurs when they don't. So the trophoblasts do a bad job of digging into the decidua, and the spiral arteries just don't change enough to allow for the increased blood flow. So let's sort of take a step back and look at the big picture. If the placenta can't gain good access to the spiral arteries, what that means is a poor oxygen supply to the placenta, which becomes more and more of an issue as the woman gets further into her pregnancy, and the fetus and the placenta require increasing amounts of blood and oxygen. So the shortage in oxygen supply makes the surrounding cells of the placenta really angry. That's a really common theme in the human body. When cells don't get enough oxygen, they get angry and they release molecules, usually inflammatory molecules. And that's exactly what happens here. The placenta releases several factors that enter mom's bloodstream. And the factors start altering the way her circulatory system works. Specifically, the factors start damaging the cells that line the inside of the blood vessels, the endothelial cells. So if this is a blood vessel, kind of we're looking at it head on, right? This is a cross section of a blood vessel. We're talking about these cells on the inside, these really thin cells called the endothelial cells that line the inside of the blood vessels. These cells are the target of those factors that are released by the placenta. These are the cells that get damaged. And the damage of the endothelial cells leads to those characteristic signs and symptoms of preeclampsia. So, for example, when the endothelial cells are damaged, they lose the ability to control the tone of the blood vessels. So it becomes harder for the blood vessels to relax. And that's what leads to the high blood pressure. The blood vessels aren't able to relax. That's why you end up with hypertension. And the factors released by the placenta also cause the endothelial cells to become more leaky, right? And these leaky blood vessels allow protein to escape from them. And so when that leakiness occurs in the blood vessels of the kidney, let's say, and protein leaks out from the glomerular capillaries, you end up with protein in your urine or proteinuria, which is one of the hallmarks of preeclampsia. And throughout the rest of the body, when protein escapes from the blood vessels into the surrounding tissues, right? And if you remember anything about Starling's forces, I know I'm asking you to dig pretty deep with this one. You'll remember that wherever protein goes, water goes. So water follows the protein into the tissues. And you end up with edema or swelling throughout the body. So swelling in the face and the hands and really swelling outside of what you see in normal pregnancy.